Delhi NCR is once again battling a seasonal health scare, but this time it's not just the regular flu. The H3N2 virus, a subtype of influenza A, has emerged as a dominant strain and it's leaving a serious mark on families across the region. A recent survey shows nearly 7 out of 10 households in Delhi, Gurugram, Noida, Faridabad and Ghaziabad have been hit with the flu-like symptoms. I am Indrajit Kaur. In this video, I'll tell you what is H3N2 and how to prevent. The ICMR has been closely tracking the infections. Numbers tell the story. In July 2025, in the week 28, 10 to 15 cases were reported. But by the end of the July, cases doubled to 20-30. In August, infections spiked to 40 to 50 cases. Doctors say this trend highlights how quickly the virus is spreading, with H3N2 leading the surge, along with RSV and the Victoria strain. H3N2 is a subtype of influenza A identified by its proteins hemagglutinin type 3 and neuraminidase type 2. Sounds technical, but in simple terms, it's the virus that keeps changing its form, making it capable of recurring outbreaks year after year. H3N2 causes more severe symptoms, longer fever, and higher chances of complications compared to seasonal flu. But which age group is more at risk? Children, the elderly, pregnant women, and people with chronic health conditions like asthma, diabetes, and heart disease. What are the symptoms? If you suddenly develop high fever, chills, sore throat, cough, and severe fatigue, it could be H3N2. Many patients also complain of body aches and nasal congestion. In children, gastrointestinal issues like nausea and diarrhea may appear. What's worrying this season is that symptoms are lasting longer than usual. Instead of 5 to 7 days, recovery often stretches beyond 10 days, with cough and weakness lingering. Doctors point out that while most cases resolve with rest and hydration, some hospitals are seeing complications including pneumonia, bronchitis, and breathing difficulties. For children and the elderly, the risk is much higher. That's why awareness and early treatments are the key. There are 7 big causes of the H3N2 virus. Number 1. Post-monsoon weather changes and humidity fluctuations can lead to this sickness. Increased crowding, and as people avoid rainy, damp outdoors, indoor congregation has led to this. Pollution and compromised air quality. Delhi regularly experiences poor air quality, which irritates the respiratory tract and weakens the lung defenses. And virus mutation and viral virulence is also a reason. Low immunity due to previous low exposure or behavioral fatigue, and delay in seeking medical attention and self-medication can also lead to this sickness. Vulnerable population and comorbidities. Elderly people, young children, pregnant women, and those with chronic health problems like asthma, diabetes, and heart disease are likely to have severe illness. Prevention is in our hands. Doctors recommend that wearing masks in crowded places like buses, metros, or markets or hospitals are advised. Regular hand washing with soap for at least 20 seconds and using a hand sanitizer when water isn't available, and avoid touching your face with unwashed hands. And keeping your home well ventilated is also very important. And for high risk groups, getting the annual flu vaccine is strongly advised. Annual flu vaccine provides protection and reduces the risk of severe illness.
So basically it's a self-limiting disease. Children has been advised to stay at home, take good hydration. However, the paracetamol is the mainstay of the line of management. We keep on getting the calls from the parents that there are cases in the child who are getting the appearance of the fever, cough, and a bilateral, I would say, both on both the side of the face there is a red appearance is there, so that somebody has slapped their child. So it makes the parents concerned.
Most people recover at home, but if you have persistent high fever, chest pain, or difficulty in breathing, doctors urge you to seek medical help immediately. So the message is simple: don't panic, but don't ignore the symptoms. This flu season, H3N2 has shown how fast it can spread and how long it can last. With a little care, timely action and precautions, families can protect themselves and reduce the impact of this outbreak. For more news and updates, stay tuned to FPJ